If you look at what one of the main things that undid Obamacare was that it wasn't really affordable care. It was affordable coverage. You could afford to have insurance, but you couldn't afford to get sick. And that was one of the things that really sort of went right to the heart of the matter, and one of the things we wanted to fix. And that's what these tax credits are for, so that if you get sick, you can actually afford to go to the doctor.
That is one of the main points Republican lawmakers have been looking to fix for quite some time with Obamacare. But how could this affect you when you go to the doctor's office? From the Fox News Medical A team, here's Dr. Mark Siegel to take us through this. And nice to see you, and good morning.
Good morning, Bill.
Rand Paul calls it Obamacare light. You have read this. You've heard what they have said so far in the plan. Is he right about that, or how does he make that point?
Well, first of all, what you just heard was someone saying that previously you went to the doctor's office and you got eaten up by a deductible. That was like a stop sign. You couldn't buy any health care until the deductible kicked in and you overfilled it, and then you could get the care you needed. Then you got a green light, you buy anything. Common cold, scratches, you came in, you overused the insurance. That's dysfunctional. It's being replaced by tax credits. But what Rand Paul is saying is, wait a minute, it's going to cost the government just as much money as before. And that's why he's calling it Obamacare light, Bill. He's saying, look, $16 billion were used for high-risk pools before, for the pre-existing conditions. $64 billion were used to subsidize the exchanges. Well, in between that number, $16 billion and $64 billion, is going to be money we're going to spend on tax credits now. Here's where he's wrong, and here's what the difference is.
Senator Paul is wrong.
I think Senator Paul is not considering. I think he's not considering that these tax credits are going to go to people that were in the gap, the Obamacare gap. Remember that famous gap? They didn't get insurance. They didn't get covered by Medicaid. They made a little bit too much, and they didn't want the individual mandate. They said, I'm going to pay the tax penalty. I'm not going to get insurance. I can't really afford it. My lifestyle won't afford it. Now we're giving the money, and we're saying, here's money. Use it to buy a product that works for you. It won't be overregulated. It won't be full of all these bells and whistles. It won't be high deductibles. It can even be catastrophic insurance, something that you need for a rainy day. An insurance of your choice. The government subsidizes that to put you into the market. We're going to reach a group that wasn't reached before, and this group is going to buy a product that works for them as individuals, so unregulated, less regulated.
The finances of it, what Senator Paul is arguing, it's a shell game. It's either right pocket or left pocket, correct? And you're arguing that is not the case.
Because an individual mandate is unethical. Because you can't, I've never believed you should force people to buy a product that doesn't guarantee you the care that you're promising. That's the shell game. Oh, you have to buy this, but you have it and no doctor will take it. Get rid of the individual mandate. It's unethical. And stop all of the regulations that force my patients to buy the kind of insurance that's clunky and doesn't give them actual care.
Or for things that they don't
with tax credits, right, with tax credits, they can buy stuff that works.
Okay, you're going to post a piece online at foxnews.com later today. Just based on what you have read, the experience of the patient, and between the patient and the doctor, will it be better under this plan or not?
It has to be better if there's less regulations. It has to be better if there's no mandates. It has to be better with large health savings accounts, by the way. Health savings accounts between $6,000 per person and $13,000 per family is a huge increase. Patients will know what the prices are of what they're getting. They'll know what echocardiograms cost. They'll know what x-rays cost. They'll know what blood tests cost, and it'll all be tax deductible. That brings it back, as Dr. Price says, to the doctor and the patient. I will help my patient negotiate the health care system, and insurance won't be that big force in the room anymore.
Listen, thanks for taking us through that. We'll look for your piece online, too. Big improvement, all right? So that's
if they can compromise in Congress.
Thumbs up so far from you, okay? Thank you, Doctor.
I got to compromise.
Mark Siegel.
Good to see you.
Shannon.